My name is Vamshi Pamla, and I'll present how our digital microfluidic platform maximizes diagnostic yield from low volume samples for neonatal and pediatric diagnostics. First of all, thanks to AACC organizers, mentors, and the judges for providing a platform to recognize disruptive technologies and inviting us to present in these finals. Our mission at Baebies is to save lives and make lives better for all children by bringing new technologies, new tests, and new hope to parents and healthcare professionals worldwide. We believe that everyone, that is what the extra E stands for in Baebies, and it's not a British spelling, everyone deserves a healthy start, regardless of their background or where they are from. We started Baebies in 2014, raised around $40 million, obtained FDA clearance for our newborn screening product Seeker, launched a CLIA lab to provide second-tier testing services for newborn screening, and recently launched Finder, our near-patient IVD product. We have 84 employees and a third have PhDs. We shipped over 9 million tests with 2.5 million shipped just this year, and every seventh baby born in the US gets tested on Seeker for congenital diseases, providing a healthy start for all these babies. We sold my first company, Advanced Liquid Logic, to Illumina, and this is my second company. My co-founder, Rich, is third-time CEO for a startup. Vijay, our product development head, and Rama, our point-of-care products head, both worked with us at Advanced Liquid Logic, and then they worked at Illumina. Lucy, our CFO, most recently took LipoScience through an IPO and then an acquisition with LabCorp. Michelle, on regulatory, brings experience from Abbott and Sysmex. Charlotte, our VP of Ops, comes from LabCorp and Roche. On our board, we have Bill Hawkins, retired as CEO and chairman of Medtronic, and Nick Naclerio, founding partner of Illumina Ventures, who both bring a wealth of diagnostics experience. We have a seasoned management team that has startup to scale up to M&A IPO experience in the diagnostic space, and we set up scientific advisory boards as necessary. Digital microfluidics is a method to programmably manipulate droplets of liquid using electric fields to change its surface tension. Here in the left video, you see a microliter-sized droplet that is dispensed into 100 nanoliter-sized droplets by just turning the electrodes on and off. This is essentially an electronic pump with no moving parts. In the middle video, you see two microliter-sized droplets mixing within a couple of seconds. In the right video, magnetic beads are washed by serial dilutions with droplets. All these operations are performed with just a circuit board, controlling the voltages applied to the electrodes, and this greatly simplifies our instrument. We have over 100 peer-reviewed publications and conference presentations on our digital microfluidics work, outlining the core technology, assays, and some clinical studies. Building on these basic droplet operations, you can see more complex assay protocols such as magnetic bead concentration, washing and elution for immunoassays, and sample prep for molecular assays in the top left video. Here you can see that the large reservoir becomes clear as all magnetic beads are concentrated into a single droplet. In the top right video, you can see how PCR is done rapidly within minutes by shuttling droplets between two thermal zones. This combination allows us to run standard assay protocols such as PCR with magnetic bead preparation very rapidly. The bottom video shows performance of multiple enzymatic assays on the same cartridge with crisscrossing pathways without affecting the enzymatic activity between droplets due to carryover. A simple droplet operation such as transport can be built into a more complex droplet operation such as thermocycling, which can then be employed in a PCR assay in a system that is then designed for a specific use case. And that is how digital microfluidics paradigm works, by building complex systems using the simple droplet operations. We have chosen to focus this technology on neonatal and pediatric diagnostics because of many unmet needs there. More than 10% of newborns are admitted to NICU, where they are evaluated using tests generally intended for adults, requiring large sample volumes, leading to insufficient testing, therapeutic errors, and readmissions. A full-term newborn normally has 240 ml of blood, while an extreme low birth weight newborn has only 50 ml of blood. Average iatrogenic blood loss per week from just testing is 11 to 22 ml. Majority of daily blood loss is attributed to diagnostic testing. 90% of extreme low birth weight infants and 58% premature infants receive red blood cell transfusions. In extreme cases, the cumulative blood loss for laboratory testing can equal or even exceed the circulating blood volume of such newborns. Due to the immaturity of hematopoietic system in such neonates, blood transfusions cause serious complications such as acute lung injury, graft versus host disease, and increased mortality. And obviously, these issues can be mitigated by reducing iatrogenic losses, which will ultimately result in a reduction in healthcare costs. Neonatologists cannot always run all the tests they would like to because of the sample volume limitations. So how do we minimize blood loss in critically ill newborns? One, sample collection can be coordinated. It has been shown that reducing the number of pokes leads to early discharge. Two, oversampling can be avoided by using smaller collection tubes because 2/3 of the blood that's drawn is usually discarded, and we cannot afford to discard these already tiny precious samples. Finally, we can maximize the diagnostic yield using less sample by running a panel of tests from a heel stick or a finger prick. Currently, multiple instruments are required to run all these tests, each with its own minimum volume requirements. And this is where Finder comes into picture. Finder is designed ground up around the particular needs of babies and the limited volume of samples available. Finder uses digital microfluidics and known chemistries in droplet format. We have demonstrated multiple assays, assay types such as molecular, immunoassay, and chemistry assays on the same cartridge. The video here zooms into a cartridge that's credit card sized, which was designed for hyperbilirubinemia. You'll see a lot of action in this video. A drop of blood is loaded in this corner into a reservoir, which then prepares plasma for total bilirubin and albumin, performing a colorimetric dye binding assay for these two. Whole blood is also lysed in the same cartridge, and multiple dilutions are performed to measure enzymatic activity of G6PD as a fluorimetric rate kinetic enzymatic assay. We have added sensors and heaters to the same cartridge here to perform rapid thermal cycling for PCR. We integrated concentration of magnetic beads, carrying nucleic acids, magnetic bead washing, RNA elution, reverse transcription, and PCR with all reagents on board. The use cases are limitless for these capabilities. We have, however, chosen to focus these capabilities on unmet needs in neonatal and pediatric diagnostics after hundreds of conversations with neonatologists and pediatricians. Universally, every neonatologist wants to maximize the diagnostic yield from the tiny samples that they are able to obtain, and they are not always able to do that. And this was echoed by the lab directors also. There is clearly an unmet need here. This roadmap is the result of all those conversations. The market is estimated to be over $1 billion. This shows a couple of early stage research projects here, shown to the right, and does not show a number of other R&D projects such as a test panel for neonatal abstinence syndrome, hypoglycemia, thyroid panel, and many others. For all these tests, panelization is not only driven by clinical need, but we also must take into account regulatory, reimbursement, and clinical workflow aspects. We are currently collecting inputs on panelization for acute kidney injury, coagulation, and on-cartridge blood cultures for pathogen identification. R&D for a number of these projects is funded by various institutes within NIH, and our key collaborators are from Duke, Boston Children's, Stanford, and University of Alabama. In the subsequent slides, I'll show data for our near-term products, which were presented at various academic conferences this year. Our first panel is for hyperbilirubinemia. 50% of term babies and 80% of preterm babies have jaundice. Normally, it takes 2 milliliters of whole blood to perform this panel, and our product in review currently at FDA requires only 100 microliter sample as input. This is a very small volume, but not unprecedented. NICUs routinely collect such small volumes only for a handful of tests. Mindful of this, we always perform a venous versus capillary study to mitigate pre-analytical factors. Then we always establish equivalence first before proceeding to performing comparison to gold standard tests. Further confirming the unmet need, it is very difficult to prospectively obtain even milliliters of samples for clinical studies from such neonates. This cartridge here shown combines enzymatic and chemistry assays, while it'll take multiple instruments to do this currently. Data here shows comparison between Finder and FDA-cleared comparator methods for total bilirubin, albumin, and G6PD performed at Duke. Due to the need for rapid diagnostics for SARS-CoV-2, we are applying Finder to perform rapid PCR to generate results in about 15 minutes. Because of our ability to rapidly thermal cycle, by shuttling the droplets, we are able to achieve fast cycling times. We'll further expand this to include other common viral pathogens that are encountered in pediatric settings. Here you can see RT-PCR amplification in all 14 positive nasal nasopharyngeal samples, while all 9 negative samples show no amplification. Inflection in PCR curves is seen within 10 minutes. We have plotted time on the x-axis here. So inflection can be seen within 10 minutes, with some positives showing amplification as early as 7 minutes. This cartridge performs RT-PCR and magnetic bead prep, which are both considered gold standard. There are no other such devices on the market that can provide results in around 15 minutes. We have designed the system to be CLIA waivable and will be pursuing it where necessary. For example, respiratory panel will be used in many distributed settings and will pursue CLIA waiver for this application, while many others may be fine operating just under CLIA moderate settings. 1 in 150 newborns have congenital CMV with about 15% developing hearing loss. This is preventable through screening, and CMV has recently been nominated for nationwide screening of all infants. This assay is under development. Again, here we are able to perform rapid PCR within 5 minutes. We have performed a clinical study with hundreds of newborn saliva samples at University of Alabama with our collaborator, Dr. Bopana. 40,000 newborns are diagnosed every year with congenital heart defects in the US alone every year, requiring millions of tests for heparin monitoring. Several millions more tests are required for ECMO patients. This panel requires testing every 4 hours, requiring 1.8 milliliters of blood each time. As you can by now appreciate, this is a problem for neonates, and therefore we are designing our platform for a sample input of 100 microliters. This cartridge here combines enzymatic and chemistry assays, which in some cases requires different platforms. This assay is also under development, and the data here shows comparison between Finder and the comparator method for factor 10A. We are also working on other coagulation factors as shown in the high-level roadmap. Here I'm summarizing these different panels with the following features. These various combinations of chemistry, molecular, immunoassays, and hematological assays are all performed on the same cartridge, each with different reagents and different droplet traffic routes, and all on the same instrument platform. These assays normally take minutes compared to hours and use microliter samples compared to milliliter samples. All assays are miniaturized versions of standard lab chemistries, and therefore we see similar performance to lab methods, but using much less sample and in much shorter time, both of which help maximize the diagnostic yield from a tiny sample from newborns. The primary component within the instrument is a circuit board because all liquid handling is electronic pumping. We also have a commercial mini tablet running Android, opening up the possibility of running apps and everything else that a tablet has to offer. This instrument has 2 fluorimeters and 1 full spectrum absorbance spectrometer. We have a low-cost instrument with high-margin cartridges. We already have placed our Seeker instruments on reagent rental model in public health labs in the US and sold the instruments in other countries. Cartridges are made with printed circuit boards, those ubiquitous green boards you see in all the electronics around us. And these costs are driven down by many other industries. Reagents usage is minuscule and does not really figure prominently in the cost, and the rest is plastics. Our recurring revenue comes from the cartridges and the expanding menu on these cartridges. For the most part, the cartridge design is fixed, and we just change the reagents that are loaded for each different panel. And with it, we also change the droplet traffic management in software. So it is literally one cartridge and one instrument, which gives us the economies of scale to maintain low COGS. We have an extensive family of more than 300 digital microfluidics patents. Our patent portfolio covers a wide variety of droplet techniques, manipulation of beads, thermal cycling for PCR, and cartridge design and detection systems. In our regulatory strategy, we first file for CE mark, followed by FDA clearance and CLIA waiver where necessary, and then pursue clearance in other territories. Most tests in our pipeline already have CPT codes. Seeker is our first product and the first in vitro diagnostics product cleared by FDA through a de novo path and a panel review. Finder is CE marked and currently under FDA 510K review for G6PD. It is cleared in Saudi and installed in some NICUs there. Clearance in other territories is currently underway. We have a robust R&D pipeline funded by NIH and a number of research collaborations established to support clinical testing. We also have a growing number of global distributors and a number of public health lab customers testing 1 in 7 babies born just in the US with our products. Finder stands out in the market on 2 fronts. One, it is a differentiated platform to maximize diagnostic yield through multiple assay types using low volume on the same cartridge. There is no commercial product yet that can combine multiple assay types into a point of care device. And 2, we are focused on neonatal pediatric diagnostics market, and there are no other companies solely focused on serving just this segment. So in conclusion, children are not tiny adults. Our low sample volume multifunctional platform enables neonatologists and pediatricians to make faster decisions for their patients because everyone deserves a healthy start. Thank you.
The time has come to announce the winner. The 2020 Disruptive Technology Award competition goes to Baebies Incorporated. Congratulations. It's been wonderful to see this competition evolve over the last 3 years, and even more wonderful to see the very strong group of competitors we had here this year. The fantastic presentations that we saw, and a truly outstanding winner, Baebies Incorporated. Congratulations again.